so before I begin, how old are you?
39.
All right, do you consent to this video?
Yes.
All right, so now I'm going to begin. I will come into my patient's room. I will provide privacy. My curtain. I'm going to wash my hands. Hand hygiene here. All right, I'm going to begin. Hello, my name is Rainisha. I'm your student nurse today. I'm here because I have to do a head to toe assessment on you due to the doctor's orders. So can I start with your first and your last name and your date of birth, please?
Darnell Pratt, 12/22/1986.
All right, Darnell Pratt, 12/22/1986. All right, how you feeling today, Darnell?
Feeling good.
All right, do you have any pain on a scale from 0 to 10, 10 being the worst pain you ever felt?
No pain.
All right, do you have any allergies to medications, food, latex?
No allergies.
No allergies. All right, so I'm going to start with a couple of questions, please. So can you tell me where you are today?
I'm in Syracuse, New York, in the living room
Can you tell me why you're here?
for a full body assessment.
All right, can you tell me what you had for breakfast today?
I had a bowl of cereal.
Can you tell me your day, what date it is? What the day is?
Today's date is July 25th, 2026.
All right, good. Can you tell me where city and state you were born in?
I was born in Camden, New Jersey.
All right, so my client's remote and recent memory are intact. My client's alert and oriented ×3. Also, my client is well groomed for today's occasion. His hygiene looks good. He's all appropriate for today. His mood and accommodation is good for today. Also, his mood and effect is good for today. Also, I see him in no distress, and he looks well. So now I'm going to continue my assessment here. Now I'm going to start, Mr. Pratt. Can you do me a favor? I'm going to do your cranial nerves now. Can you do me a favor and can you close your eyes and occlude one nostril for me and tell me what do you smell here? It's cranial nerve 1.
Smell like spearmint gum.
All right. So I'm going to do the same can you do the same for the other nostril, please?
Smells like alcohol, hand sanitizer.
All right, you can open your eyes now. Thank you. So cranial nerve 1 is intact bilaterally. All right, so now for cranial nerve 2, if I had a Snellen's chart, I would have my client stand 20 feet away from the chart, and he will read the lowest line that he can read by occluding one eye and do the same for each eye. So for cranial nerves 3, 4, and 6, I'm going to have you, can you look at the TV here for me, please? All right, so I'm going to have you look here. It's a little bright, sorry about that. Follow my pen, just with your eyes. Okay. Now can you just follow my pen with your eyes again, please? All right, so cranial nerve 3, 4, and 6 are intact. My patient's pupils are equal. They are equal, react to light and accommodation. They are equal, round, and react to light and accommodation. So for they also are 4 in diameter and no nystagmus noted also. So now I'm going to move on to cranial nerve number 5. For cranial nerve number 5, can you just close your eyes for me, please? I'm going to touch you on your face with, can you tell me if it's sharp or dull sensation you feel on your face? All right, I'm going to get started here.
Soft. Sharp. Soft. Sharp.
All right, you can open your eyes now. All right, I'm going to ask that you clench your teeth together for me, please. Now I'm going to palpate the masseter. Alright, they are equal bilaterally. Alright, so cranial nerve number 5 is intact. So now I'm going to move on to cranial nerve number 7. For cranial nerve number 7, can I have you please smile, frown, puff out your cheeks, raise your eyebrows, put them down. So facial movement is intact bilaterally. I see no signs of facial drooping. So now I'm going to move on to cranial nerve number 8. All right, I'm gonna stand behind you, Mr. Pratt. Can you occlude one ear for me, please, and tell me what you hear when I whisper?
1, 2, 3.
All right, now do the same with the other ear.
4, 5, 6.
All right, so cranial nerve number 8 is intact. Both ears, no heart, no heart. He's not hard of hearing. All right, so cranial nerve number 9. If I had a tongue depressor, I would check my client's gag reflex. So cranial nerve number 10. Can I please have you open your mouth, please? Side. All right, I see the uvula rises. The uvula is there, midline, no deviations to the left or to the right. So cranial nerve number 10 is intact. Can you open your mouth one more time for me? So cranial nerve number 12 is say ah.
Ah.
So cranial nerve number 12 is intact. The tongue protrudes and rises and no deviations left and right. All right, can you now for cranial nerve number 11, I'm going to have you sit up for me. All right. I'm going to push down on your shoulders and you push up. All right, ready to go. All right, same with your face here. Can you turn to this side? Up. All right. To my resistance, turn. All right. Cranial nerve number 11 is intact. Strength. All right. So now I am going. All cranial nerves are intact. All 12 cranial nerves are intact. So now I'm going to move on to my patient's skin. So just on general appearance, the inspection, I see that the skin is clean, dry, and intact. I see a couple of tattoos, but it looks like they healed well. No signs of infection or redness or inflammation. I also note that the client's skin color is the color of his, he's up to par for his ethnicity. Now I'm going to begin to palpate my client's upper. So the skin is clean, dry, and intact bilaterally. No warm, feel a little bit of warmth. No paler. All right, so now I'm going to palpate my client's radial pulse here, bilaterally. All right, my client's radial pulses are 2+. All right, now I'm going to ask my client to flip his hands. Can you flip your hands for me, please? I am going to check the skin Kruger bilaterally. No signs of tinting. The skin returns back in place less than 2 seconds. Now I'm going to assess this cap refill bilaterally. I have your hand here. All right, my client's cap refill returns in less than 2 seconds bilaterally. All right, so now I am going to check my client's bony prominences. Can I see your elbows, please? All right. Okay. Can I see your knees? Okay. Other knee, your heel here. Okay. Your other heel. All right. I will also look at your sacrum. Okay, so my client's bony prominences, I see no openings, no redness, so I don't see any ulcers, so I'm going to continue to keep. I'm going to go on and perform hand hygiene here. I'm going to don gloves now. Alright, now I'm going to check my client's head. I see that it's normal cephalic. Just general inspection. Now I'm going to come in. I'm going to inspect his head. Any pain or tenderness?
No.
Alright, I feel no lumps, bumps, or masses or lesions. I see no infestations or anything of that sort. I also see a full head of hair. No signs of alopecia. The hair is growing distributed and normal throughout his head. So now I am going to move on to my client's ears. On general inspection, I see that the client's ears are the color of his ethnicity with no redness. I don't see any drainage or anything. No lumps, bumps, or masses. I'm going to look at the back. No breakdown back behind his ears. No breakdown. Now I am going to palpate my client's ears. I am going to palpate the oricles. Any pain or tenderness?
No.
Alright, I'm going to palpate tragus. Any pain or tenderness here?
No.
Alright, the client's ears are equal bilaterally. No pain or tenderness noticed. Skin is clean, dry, and intact. I see no no drainage, no cerumen, nothing blocking the airway. Also, now I am going to palpate my client's frontal sinuses. Any pain or tenderness?
No.
Alright, now I'm going to palpate my client's maxillary sinuses. Any pain or tenderness?
No.
Alright, no pain or tenderness noted bilaterally. Now I am going to move on to, you can open your eyes for me please. I'm going to have you just look at me. I'm going to assess your eyes a little. Alright, the skin around the eyes. Match my client's ethnicity. I don't see any signs of any jaundice. I don't see any drainage, any signs of conjunctivitis. Now I am going to ask you to look up for me. I'm sorry, this light is a little bright. Alright, same with this eye, light a little bright. Alright, so my client's sclera is white. The conjunctiva is pink and moist in both eyes. Again, no signs of jaundice or any type of infection in his eyes. Now I'm going to move on to your nose. Can I have you look up just a little bit for me? Alright, his nose, the color around is true to his ethnicity. I don't see any redness or any drainage or anything coming from his nose. So now I'm going to palpate. Any pain or tenderness?
No.
Alright, no pain or tenderness noted. Each nasal flare is equal bilaterally. Now I'm going to look inside of my client's nose. No drainage. The mucosa is pink inside. No excess fluid. Everything is good. Okay. Can you take one of your fingers and include one nostril for me, please? And breathe in. Alright, do the same with the other. Alright, nasal patency is equal bilaterally. And alright, so now I am going to move on down to my client's neck. You hold it. Oh, nope, your mouth. Alright, I'm going to look at my client's mouth. The skin around is clean, dry, and intact. I don't see any signs of any redness or cyanosis or anything like in that nature. I see he has pink lips, moist, no chappedness. Now I am going to ask my client, can he open his mouth, please? Open your mouth. Going to check inside. Alright. So he has a mouth, he has all his teeth, no broken teeth, no chipped teeth, all are intact. I see no signs of cavities or decay, no gingivitis. The buccal mucosa is pink and moist. His no tonsils. I see that his tongue is pink, moist. His soft palate and hard palate are pink and moist, and no signs of deviation. All right, I'm gonna ask you to close your mouth. I'm gonna keep going. So now to your neck. I'm gonna ask you to hold your head up for me, please. On inspection, his trachea is midline, no deviations to the left or the right. Now I'm going to palpate. Any pain or tenderness?
No.
Any pain or tenderness?
No.
All right. So his trachea is good. No deviations to the left or the right. Equal bilaterally. So now I am going to place my stethoscope here. I'm going to palpate his carotids one at a time here. All right, that's a 2+. Bilaterally for his carotid. Now I'm going to listen with the bell of my stethoscope for any bruit. Breathe in, breathe out. Same, breathe in, breathe out. All right, no brewery noted. Okay, so now I'm going to ask for you to please remove your shirt, please. All right, so a general inspection of my client's chest. I see his skin is clean, dry, and intact. No signs of any open areas, lumps, bumps, or bruises. I see some tattooing, but again, no signs of infection. So now I'm going to ask you to stand up, please. All right. So now I am going to assess my lung sounds. Turn around for me. Posteriorly. Relax. When you feel this, I'm going to ask you to breathe in and breathe out. Ready? Go ahead. Take a deep breath in. Out. Again. 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 All right. You can turn around. Well, don't stay right here. Sorry. Lung sounds are clear throughout. No signs of bronchi, wheezes. Alright, now I'm gonna need for you to please take a deep breath in and out. Inhale, exhale. One more time for me, please. Alright, my client's chest expansion is good, equal bilaterally. No signs of a barrel chest. Alright, so now I am going to assess your CVAs. You tell me if you feel any pain or tenderness when I do this, please. Any pain or tenderness?
No.
Any pain or tenderness?
No.
Alright, no CVAs, noted, no pain or tenderness. Alright, you can turn around so I can listen to your anterior lung sounds. The same as the back. Can you just take a deep breath in and a deep breath out as I place my stethoscope? In, out, same. In, out. All right, same. No rubs. No lung sounds are clear bilaterally. No sounds of no eventual sounds. No rubs. No wheezes. Noted. So now I am going to assess my client's his heart sounds. All right. So the second right intercostal space, that's the aortic here. The second left intercostal space, the pulmonic. The third left intercostal space, that is the Erb's point. The fourth left intercostal space, tricuspid. The fifth left intercostal space, that is the mitral. I will also listen to my apical pulse here. And in each space, I would then go back and listen with the bell, but I have not noticed, I've noticed the S1 and S2, the lub dub, no sounds of any rubs or murmurs or anything in that nature. So now I'm gonna have my client sit down for me. Can you lay for me, please? Alright, now assessing my client's abdomen. Here I see the umbilicus is midline, no striature or anything like that. Can you tell me when was your last bowel movement?
This morning.
Alright, is that normal for you?
Yes.
Have you been having any diarrhea?
No.
Alright, do you have any problems with your urination starting or stopping your stream?
No, I have a good stream.
Alright, so now I'm gonna get started here. I'm gonna auscultate your abdomen here first. I'm gonna start in your right lower. And I'm gonna go on up to your right upper. Your left upper. Your left lower. Alright, bowel sounds are normal active in all 4 quadrants. Now I am going to gently palpate in all 4 quadrants. You let me know if you feel any pain or tenderness, okay?
Yeah.
Alright. Any pain or tenderness?
No.
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 Alright, now I'm going to deep palpate, okay? Any pain or tenderness?
No.
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 Alright, my client, no lump. I don't feel any lumps, bumps, or masses in his stomach. Every quadrant is all good. There's nothing, his bowel sounds are normal active. Alright, now I'm gonna need for you to sit up, please. Now I am going to inspect your lower extremities here. So upon inspection, I see your skin color is good. For your ethnicity, I don't see any swelling or I don't see any edema. I also see no cyanosis or redness. The hair is distributed evenly throughout. So now I am going to palpate here. So my client's skin is clean, warm, and dry and intact. Bilaterally, I am now going to palpate my client's dorsalis pedis here. Alright, 2 plus bilaterally. Now tibia, inferior tibialis. 2 plus bilaterally. I'm also going to come down and assess my client's pap refill on his toes. Okay. Less than 2 bilaterally, so it's good, intact. I'm going to have my client dorsiflex. Both at the same time. Alright, plantar flex. Alright. Muscle strength is a 5 out of 5 at the bottom. Now I am going to ask for you to lift your leg up. Yeah. Now, other. Extend. Alright, extend. Alright. No crepitus noticed in either knee. Muscle strength is good, 5 out of 5. Now I'm going to check my DTRs. DTRs are intact bilaterally. And now I forgot to popliteal pulses here. Alright. My client's popliteal pulses are 2 plus bilaterally. Alright, now I forgot to. I'm gonna perform hand hygiene here. Put on some new gloves. Alright, can you stand up? Because I forgot one thing. Your upper extremities. Can you extend out for me? Adduct. Adduct. X. Hyperextend. Alright. Now can you do yep. Alright. No signs of crepitus in my client's upper extremities. Can you also take your hat from me and up, down, just your head, neck to your shoulder. Other side. Alright, my client's neck range of motion is good. Alright, so now I need for you to turn this way for me. Bend down some. Alright, then back. Twist side to side. Yep. Yep. So I'm seeing no signs of scoliosis, lordosis, kyphosis. Client is upright posture. It's good. There. Turn around to me. Alright, so now I just need for you, almost done, Mr. Pratt. Just take a straight walk. Now back to me. Alright, client gait is straight and straight and steady. Alright, can you walk heel to toe for me? Alright, come back. Alright, gait is steady, straight, stride is good. Alright, so now can you just step forward for me just a little bit? Alright, now I need for you to close your eyes. Alright, keep your hands to your side. Alright, so now my client's rumbar is negative, no swaying. Alright, you can open your eyes for me. Alright, you can sit down for me now, Mr. Pratt. Alright, now, are you okay?
Yes.
Alright, I'm gonna take off my gloves. I'm gonna perform hand hygiene. I'm going to make sure my client's bed is in the lowest position. His brakes are on. Do you need anything before I go?
No, ma'am.
Alright, so here's your call bell, and now I'll go to proceed to perform hand hygiene and document my findings and how my client reacted to the procedure. Thank you.